So there are people that experience having multiple personalities, and there are different definitions on this in psychiatry. And the next time you go to the doctor, you have to think, did my doctor actually do this? Now, do not kill your doctor if he doesn't, but basically whenever you see a patient, and sometimes you do it more specifically than other times, you know, like in psychiatry, for example, you will do it more specifically than if you go to your GP because you have a cold, for example. But basically every medical problem can be derived in three factors, and that is a biological factor, a psychological factor, and a social context. Let me give you an example. Someone has a child with a brain tumor in a third world country, and they do not have money to pay for the surgery. Okay, so you have biology, which is like the brain tumor. Psychology is, it's a child, so the parents are probably very worried and scared and sad. And so social is basically like their economical status. They don't have money to pay for the surgery. They're from a third world country, so they don't really have social security and all of that. So these are like the three things that we look at. Don't be mistaken, even in Western countries, modern countries, the social component is so important, because a lot of people live in social deplorable conditions, and that is so detrimental for their health and their psychology, like their mental health too. This one is our Bible in psychiatry. It is called the DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders. That's actually all you need to know about that exists, DSM-5. Always look for DSM-5 criteria online. It's like the best thing you can Google, because otherwise you're just going to get misinformation and bad information. So if you just Google, for example, depression plus DSM-5 criteria, you can actually see, okay, does this person that I know, or do I fit criteria, yes or no? And if you're worried about your mental health or about potentially having a mental illness, make sure to check with your GP in order to get a referral. Maybe this is the most important slide, because if you get this slide, you will understand mental illness so much better from a medical standpoint, okay? Not from like a psychological standpoint, but from a medical standpoint. So I made this little joke. Obviously, there's no tier 1, tier 2, and tier 3, but whatever. So you have three very important ones, which is cognition, conation, and affect. And those three are like the three levels in your brain where medical illness might manifest. For example, in cognition basically means everything that has to do with thoughts, everything that has to do with performing a task, for example. And dementia is a really good example for people that are losing their cognition. So they can't do tasks anymore. They forget who they are. They forget about their relationships. They don't find a way anymore. They don't know how to make coffee anymore. You know, like basic things that are just instilled within you, that you've grown up with, that you just can't comprehend to forget. You just forget about them, okay? Conation, which is a very weird word if you ask me, but anyways, anything that has to do with conation has to do with actions, things that you do. For example, the one that everyone knows, ADHD, people that are very impulsive, people that are very busy, they're hyperactive, you know, those are their actions. Especially impulsivity is one that is very important in psychiatry, because if you're an impulsive person, it is so easy for you to get into trouble, to get into drug abuse, to get into other stuff. So it's really important to know that you can also have problems in that area. And then the last one is affect, which has everything to do with mood. Obviously, depression, for example, you're in a very sad mood, but you can also have bipolar, for example, where you're switching between sad and manic, like really happy, and sad and really happy, you know. So those are like the 3 levels or 3 tiers that you have to look out for in mental health. Basically, in most psychiatric disorders, you will always have something in every single aspect, because the way that your brain is wired, you have like so many different pathways, so there will always be some sort of symptom on every different level. Know that mental illnesses and also medical illnesses, but mental illnesses more, are always kind of on a spectrum where you have like very severe and very light. In mental illness, it is very personalized and it's very different from patient to patient. You basically can't have 2 in the same patients. You can't have patients that have kind of like the same, how do you say it? Same symptoms that you see, but they manifest differently. An illusion is basically when you see something that is real, but your mind makes something different out of it. Okay? So for example, I could be seeing a rope and you think it's a snake, for example. A hallucination is seeing and hearing things that are not there. Like for example, if I would say, oh, I have a human on my shoulder, you'd say like, yes, you don't. I would be like, yes, I do. You see, that's a hallucination. Especially if you like, the thing about hallucinations is you really believe in it and you really see it and you really hear it, which is so weird for people that don't see it and don't hear it to understand that. A delusion is when someone sees or interprets things wrongly. For example, one of the most common known delusions is jealousy delusion. It's like basically when people are in a relationship and someone has like such is so insecure that they think, oh, you're cheating the entire time, or cheating the entire time. And they will really believe it. This is like when it becomes pathological, where they really will believe it. That's a delusion. And an obsession is basically a fixation on something that is also pathological. For example, thinking that everything that you touch is full of germs and you will absolutely get sick and stuff like that. That's an obsession. An obsession is basically your own thoughts. These thoughts are in your head and you can't get them out, and they give you a huge, huge anxiety. Mostly an obsession leads to a compulsion. You see? And when you do a compulsion is always an act, a physical act. That anxiety that you were feeling is going away.